Okay, go ahead and present. All right, I'm gonna go ahead and let in everybody here. Okay. Hey, good afternoon. Thank you for joining. We're going to give people a second to hop on and get admitted into Zoom. And so I hope you're all having a great Friday so far. Kind of a little bit awkward with the different changes in weather for sure over the past few days. And so welcome to Health Council Talks today. My name is Geraldine Antonio, and I work with the New Mexico Alliance of Health Councils as a tribal liaison, if this is your first time here today. And we host our Health Council Talks as a resource for health councils to share with their communities, and just a way to get information out, different services and programming in our state. So today we're going to be discussing a topic around sexual assault and support for that. And let's see, I'm going to go ahead and go to the next page here. But if you all have a chance in chat to add your name, your health council, or your organization's name, we greatly appreciate it. And so I'm going to go ahead and start off here with our land acknowledgement. The New Mexico Alliance of Health Councils humbly recognizes and acknowledges that we are on unceded territory and ancestral lands of the original peoples of New Mexico's Pueblos, Apache Nations, and the Navajo Nation. Together, we acknowledge the history of genocide, disposition, colonization, and ongoing systemic inequities, while strengthening and respecting relationships with Indigenous peoples. We give thanks to the past, present, and future stewards of this land, and respect all tribal nation sovereignty. And offering this land acknowledgement, the Alliance affirms Indigenous resiliency, self-determination, and self-governance of New Mexico's tribes and nations who are still here today. And so thank you for allowing me to open with a land acknowledgement, as well as just considering the uncertainty of times today and a lot of the challenges that people of color, as well as our vulnerable populations, are facing with many of the changes from, our federal and administration. So thank you all for joining. If you're just joining, just a reminder, if you could put your name, health council in the chat, as well as any information you'd like to add. So pretty informal. Just a few quick reminders. We are having a community collaborative forum, which was originally part of the DOH. It may be deliverable 8. And so that was collaborating with the local behavioral health collaboratives, as well as early childhood coalitions. It is a hybrid event, so registration is open. The in-person space is almost near its limit. So if you'd like to join in person, don't forget to register. If you'd like to be virtual, obviously that's not capped at any point. So I just wanted to remind you all, if you are interested in joining that. Our next peer learning session is on April 23rd, and that is with the topic around access to transportation. And if you have any questions about the membership agreements, please reach out to me or Val, as we are in the process of reaching out and following up with health councils. And you may have already heard the update. Very quickly before we go into our presentation today, just wanted to let you all know and thank you all so much, health councils and partners, for all of the collective effort for advocacy. Obviously, we continue to update, but we actually have a total of $4 million from this legislative session for health councils, $3 million of it coming from House Appropriations Finance Committee, and $1 million, which is also a really great way to end a session, is enlisting Senate Finance Committee. So they were able to provide $1 million to health councils, which brought the total up to $4 million. However, right now, we are, just waiting for DOH to learn more about the procurement process. And so we'll hear more from our friends at JOH. So that was just a quick update. However, if you have questions or you like me and Val to come meet with your health council around this, we'd be happy to do that. So please feel free to reach out to us, ask questions, and definitely send those emails if you have any thoughts around it. Okay, so thought I'll share that. I know we probably shared it a few times. Okay, so if you did join just a little bit late, this is our Health Council Talks. We do this on the 1st and 3rd of every Friday. We bring in different state agencies, different partners, different organizations to share different services and programming that can support the work of health councils. So I'm going to go ahead and hand off to our friend today, Abigail. She is with the New Mexico statewide sexual assault helpline. So Abigail, would you like to introduce yourself and also share screen?
Yes. Hello, everybody. My name is Abigail Boynton, and I am one of the co-directors for the New Mexico Sexual Assault Helpline. I typically go by Abby, so you might hear me or my co-director Sonia use that interchangeably. Sonia is my other co-director, and she is out for her birthday, so I hope she's having the most wonderful, relaxing time. So it's just going to be me today. Super encourage you guys to participate because although I used to be very confident in public speaking, I got really used to having a co-director and doing it together. So if anyone wants to jump in and help me feel less awkward, that would be awesome. I'm going to talk about a few things today, but before we start talking about the New Mexico Sexual Assault Helpline and the services we provide, I had been asked to kind of talk about some of the statistics currently in New Mexico. And the New Mexico Sexual Assault Helpline is a project of the New Mexico Sexual Assault Coalition, or the New Mexico Coalition of Sexual Assault Programs. So, what NMCSAP has done in the past years, they came out with the NM Crime Victimization Report. I have the PDF version that I had just recently sent over. Can you send that out to everybody after the meeting?
Absolutely. And I also posted in chat for others if you want
Oh,
to
great.
go along.
Cool. Yeah, it's very lengthy, lots of good information. It is a 54-page document. So I am only going to focus on one slide or no, one page today of that. So let me share my screen real quick. Okay, cool. So on this page, what I really want to talk about is the vulnerable populations, especially in the state of New Mexico, just to bring some attention to that. So 40% of respondents within this crime victimization survey reported that they had been victim of either stalking, rape, sexual assault, or domestic violence in the past 12 months in the state of New Mexico. And then throughout the report, you'll see the varied demographics and all of this as well. One of the bigger things I wanted to talk about was those who have ever been.
Abby, apologies. Can you also Zoom? We just got a request in chat.
Oh, yeah, absolutely. Is this better? Can we see a little bit better? Or do we need some more?
Think that might be okay. Thumbs up.
Yes, thank
Okay.
you.
Okay, cool. Yeah, absolutely. Sorry. Thanks for asking. So one of the things I want to bring to your attention is those who have ever been incarcerated had the highest victimization rate at 69%, compared to those who have never been incarcerated at 35. So something the New Mexico Sexual Assault Helpline has just recently took over as of February is the PREA hotline as well. So while we serve the entire state, we also serve everyone who isn't currently incarcerated, trying to get in contact with the Prison Rape Elimination Act hotline. Another really vulnerable population is those who have ever been homeless, with a rate of 67%. So again, we're just seeing our vulnerable populations really popping out on this survey. Black and African American respondents are also more likely to have been victims trans transgender, non-binary, at 58% is more likely, which is higher than the 40% rate. Sorry, there's a lot of like extra notes in here about why they're like not adding up completely to 100% and all of that, which is why I want you guys to read the whole thing. And then younger respondents are more likely to have been victims of crime, at 54%. And then the percentages drop as the ages get higher. I think that can be due to a lot of reasons. I think it's a lot easier to disclose when you're younger. And I think there's a whole thing just like culturally within New Mexico about wanting to talk about any trauma or abuse that has ever occurred. But we also know our youth is a vulnerable population as well. Hispanic respondents are also more likely to have been victims. And then we get into those with household incomes of less than $50,000. So our impoverished populations are also being victimized at a higher rate. And respondents of color are more likely to have been victimized than white and non-Hispanic respondents. I think that this part is super important to not only me, but to everything you all do as well, because you guys can see it in the work that we do. These are the communities that we are serving more often. And while we do serve everyone, and I think everyone can really agree that we strive to serve anybody regardless of any of their background, these are the people being victimized at a higher rate. And it's really unfortunate. But we have some new resources in our state to give them a space to talk. So while in New Mexico, we have a very good amount of rape crisis centers, sexual assault nurse exam places, children's advocacy centers, counseling, free mental health care. We have I think we're a pretty well-resourced state. All of those agencies are really burnt out and overrun with just so much. Really high client loads, really high turnover because the work is really hard, and it's really heavy. So what we wanted to do is create a helpline to help add capacity to all of these wonderful resources in our state. I'm so sorry. I haven't given a presentation by myself in a while, so like my mouth is really dry because I'm just doing my best. But yeah, so the New Mexico Sexual Assault Helpline, this is different than something like RAINN or 988 or New Mexico Crisis and Access Line, which are all really good resources. But this is really specific to New Mexico for one. So this is not a nationwide resource. And something that's really special about us is all of our responders who are answering the line are all here in New Mexico. And they're all in different parts. And the reason I think that's super important is because if you've ever lived in one place and then moved to another town within New Mexico, it is so different. I just moved from Las Cruces to Albuquerque this past week, which is why my background's a mess and blurred out. But even moving from Las Cruces to Albuquerque, like the vernacular is different, the way people talk is different. Of course, the like size of the town and like the traffic and all of that is different. And then even from Albuquerque to Farmington or to other like cities that are more rural areas are just so different. And so by being able to have responders all over the state, we really are constantly trying to be as culturally comprehensive as possible. I think that's an ongoing mission and something we will always work towards. I don't think that ever one day we're going to wake up and be like, we're 100% culturally comprehensive. But I think we're always working towards it. Everyone has a map of the state and we all do an activity just to make sure we know how to best serve each population. So we do have a vanity number, which is 1-844-NMSA-HLP. But we also have a regular number, which is 1-844-667-2457. And then we have our website, nmsahelp.org. So we are 24/7 call, chat, and text enabled. Um, whether you want to get on from your computer, you can access us, or from your phone. We Well, we are not associated with 988. Sorry, I got a chat and I just knew. Um, Sorry, I just want to clarify. We're not associated with 988. We're a little bit different than 988. 988 is more of a nationwide program where they have people all over the nation being able to answer any type of crisis with a focus on suicidal ideations. And we're an additional resource with, like, in the category of like different types of helplines. And we're also specific to sexual assault. We're never going to ask if someone was sexually assaulted, though. We're going to assume that people who need to get to us are getting in contact with us. So if people just want to call and chat and not talk about their sexual abuse, they don't have to. And I'll talk about that more right, right here. So I'm going to talk about like the 4 main functions of the helpline and how we're designed to work. And then if you guys have any questions about any of them, let me know. So we can refer to local programs. So if someone calls us and they're like, a really good county would be Socorro County because they don't have any rape crisis centers or SANE programs within that county. So if someone in Socorro County called us and they said, I've been sexually assaulted and I don't know where to go to, I need an exam, I need to meet with law enforcement, I want a case manager, I want therapy, we can connect them. So we'll talk to them about anything they want to talk about. And then if they want to be connected, we'll give them some options as far as, do you want us to 3-way call and connect you right now to somebody? Or do you want the phone number to call on your own? Just really stressing the importance of giving survivors their choice back from the very beginning. As far as like, we really want to value like confidentiality and letting them share what they want to share. So if someone calls and they're telling us about this horrific assault, and we're not going to say, well, can you tell me your name? Can I get your phone number? Uh, we're going to let them. We can say, if you would like to share that, please do. We never want to force any information out of anybody. So if they want to be referred to their local services, we absolutely will get them connected as quickly and as best as we can. And if that's like the immediate need that they're talking about as soon as they call us, we will try to get them connected before they have to tell their whole story. Because we want to minimize the amount of time someone has to say what's going on, right? But another function is connection for rural and isolated survivors. So I think we all know, like, New Mexico is very land massive, and we have a ton of like really small communities. And even just like driving through the state or driving through these smaller communities, it's really hard to imagine what it could be like for everyone. Even so, I worked at La Piñon for 10 years, and at La Piñon, which is in Las Cruces, which is the 2nd largest city, everyone knew everyone still. It's really hard to walk into your local rape crisis center in a rural community, or even the larger ones here in New Mexico, and not know somebody. And that can definitely be like deter someone from wanting to get services there. So we want to be this like outside connection for someone who might just want to talk about it, and maybe they aren't ready for services, or they don't want to drive an hour or two to the next place where they could get services, because that can, in a lot of different counties here, you are looking at a 1 to 2 hour drive to get services. And so we want to make sure that they have the opportunity to say what they need to, talk about what they need to, in a really realistic way for them. We don't ever want someone to call and say, I've been sexually assaulted and I want to talk about it. And our first response is never going to be, well, I need to get you into services. Um, we really want them to, you know, do they want to get services and should we problem solve that together? Or do they just want to get this off their chest? Because in reality, they've been surviving this on their own probably for generations, especially in a lot of our smaller communities. Um, and another thing with that is we always answer the phone with New Mexico Sexual Assault Helpline. I'm here to listen. Um, Instead of, you know, saying, how can I help you? Or what can I do for you? Because our biggest goal of this is to offer an additional layer of support. Um, we don't want to just keep passing around clients to several different agencies because they feel like their needs aren't being met. Um, and sometimes instead of having a solution for every problem, um, we just will sit with them in their discomfort, and help, you know, normalize that this is not a comfortable situation and it's okay to have all these feelings that they're feeling and that they don't have to get into therapy tomorrow if they don't want to, you know? Um, Another function is a pathway for survivors not accessing services. Sorry, I'm going to check the chat real quick. Yes, I do have marketing tools, and I will talk to you guys all about that here in the end because that is a great question. And there's several different ways you guys can request those from us. So we're also a pathway for survivors not accessing services. So like I was talking about with our rural communities and isolated survivors, I think there's a variety of reasons why people may choose to not go to an agency. As far as you might know everyone there, you may just not want to get services, and that's a totally okay and respectable decision. Um, you know, people really have been surviving this for generations on their own, especially in our smaller communities. Um, I think there's so many different things that can lead people to choose that they don't want services. And what we're trying to do is give them some sort of option that's still 100% confidential. So there's never going to be the pressure of having to give us their personal information or that we're going to like call law enforcement over to them or like try and trick them into services. If they just want to call and say, you know, this is the first time I've been able to say in 50 years that I was sexually assaulted as a kid. And I just wanted to get that off my chest and say it out loud. And that's it. That is so okay. Um, Also, with our isolated survivors or survivors who are choosing to not access services, sometimes they just need connection. And we are absolutely a source for that. We have no time limits on any of our calls, chats, or texts. So if they want to be on the phone for a couple of hours, we'll sit on the phone with them for a couple of hours. And they don't have to be talking about their abuse that whole time. If they, very recently, we keep having someone calling asking about the weather every day. And that's so okay. I think that it's very real to take your time and wanting to disclose to a complete stranger over the phone or you know, really even realize that what you've been through is sexual assault. Building rapport is just a really big part of what we do. And then our fourth option is enhancing survivor services infrastructure in New Mexico. So this one is a little more tricky because how I just said, everything's confidential and we're not going to ask any questions. We don't. But if someone calls us from Socorro County and there's like, hey, I'm in Socorro County and I want to get an exam, we will still record that information with the goal of, you know, if we're getting 15 calls a year from Socorro County for SANE services, that's a really good indication for us at the coalition that we need to start building out a SANE program in Socorro County. And that goes for many other counties. Like I said at the beginning of this call, I think we're very well resourced, but I don't think that it's enough either. I think that we can have more everywhere. I think, you know, the larger cities sometimes feel like they're better resourced, but their caseloads are really high too. And then you have your smaller programs where it's a really small city, but their caseloads are crazy high too. I think there's room for everywhere to expand on their services. And we know that funding is a huge issue. So we want to see like where's the biggest need, how can we help do that, and in the meantime, how can we help add some capacity, especially for our agencies that are doing paperwork and meeting with clients in person every single day. They may not be able to stay on the phone for 2 hours with their clients, and that's totally reasonable and understandable. So if you have those clients who call every day or need that extra support after a session or something, we're there to provide that. Does anyone have any questions on our functions before I talk about our referrals and marketing?
Yes, just a question in chat, Abby. Do you have any services for families who might be missing family members?
We'll talk to anybody about anything. So if someone wants to call us and talk about what they're going through, we'll provide support for them in that. And then if they want to be referred somewhere or be provided some extra information, our responders are trained to make sure that they get connected to somebody they haven't already been connected to. But sometimes in those cases too, it feels like when we get those calls, or naturally when you get that call, you just want to problem solve. But that's a really hard situation for the family member calling too. And so we want to make sure that we're providing them support and we're giving them their space to, feel all of the feelings that they're having, and um, talk about their fears and talk about what they're thinking are possible solutions and what they can do. Um, and just be there for them in that moment. So that's what we're currently doing with that. So there's a couple of ways to use this as a referral for right now. So a warm line referral for survivors who don't need immediate advocacy or an immediate exam. So anyone who is already in services, someone who doesn't want case management services or say an exam, somebody who's really just looking to, like, if you have someone who has nightmares every night and at 3 a.m. and they need something extra to put down for their coping techniques to add something on, we would be a really good resource there. And then also included as a resource for support for survivors creating an emotional safety plan or looking for expanded resources. So a lot of the time, especially with kids, I think they just need someone extra to talk to. And the cool part about an MSA is that the texting, we're not going to ask them for their name or anything. They can stop whenever they want. Even if they like stop texting us back, we wait 15 minutes to see if they're going to say anything, and then we end it. But at the beginning of each chat, we let them know, like, if we end it, we don't ever want to like double text, because what if they're not in a safe environment and someone knows that they're getting text? So we let them know if we end it, why we're ending it, and how to get back into contact with us. It's just texting us again. Or people looking for expanded resources, again, like someone who has nightmares at 3 a.m, or even parents who, feel like they're at their wits' end dealing with their kids. And it doesn't even have to be sexual assault related. It could be domestic violence. It can be just dealing with really difficult things, or stalking, or their teen is just going through a really hard time and they don't know how to get them help. It can be really anything. Um, so I did send over a couple of links as well. There's a link on scheduling a presentation with us just for like your specific agency for me and Sonia to come out. It's way better when Sonia's here too. I swear I go slower and I know what I'm saying. And there's also a link to request materials from us. So you'll just say, like, if you want posters. So we have like little square posters we send out with all of our logo and our information. And then we also have smaller like business cards in English and Spanish that you can give out to clients if they just want to stick that in their wallet or behind their phone case or anything like that, just in case they ever need us. Do you guys have any questions right now?
I do have a quick one, Abigail. Do you all work very closely with like a state agency?
I'm sorry, with who?
A state agency? So like healthcare authority or some like DOH?
Um, Personally, Sonia and I also don't handle the funding for it. And I'm saw that would be more of a question for um, Rachel and Alexandria. I saw someone asked, where do we receive our funding from? Currently, we're on a non-reoccurring grant from CVRC or through CVRC, but I think we're getting that switched over to BHSD um, to be the distributor. I'm not 100% on the funding anymore because everything's been a little bit crazy. So that would be more of a question for our deputy director, our executive director. I'm so sorry. I just don't want to misspeak.
Perfect. Yeah, no, thank you. I always thinking BHSD. Okay, yeah. Thinking about the development of these closed loop referral systems that's happening statewide. And so always just learning to see if there's any way, right? Things like that are happening. Well, especially with your work with the hotline. And so, yeah, thank you.
Yeah, of course. And everything's been like real back and forth lately too. So we're just very grateful that we still have funding to continue going and utilize us as much as you guys can. We have so much materials, so please, you'll get that link sent over to you to request a presentation or request materials. We're so happy to send things over if you want them delivered in person or you just want to meet with us. Like we're so good with that too. And then our emails are on this presentation and they get a copy of this presentation, right?
Yes, they do. Is there any chance you're able to show the materials to just to show health councils what to expect?
I think I have some right here actually.
Okay.
So maybe. So these are our Spanish cards, and these are what they look like to hand out to clients. It has a QR code to take them to our website. And then our phone number, our website written down as well. And then it's a text call chat up here at top 24/7. And then we have these in English and Spanish. And then I don't have any posters with me right now, but they're basically this, but a little bit bigger. They're not like a full-size poster. They're a little bit smaller too. That way we just don't want to I don't know. I feel like if there's a QR code on something and it's a giant poster and someone's going up to it, like then they're really exposing like that they're looking for that and people may be more embarrassed or more shy to go up and do it. So I feel like the more secretive we can be with this, hopefully the more people we can reach.
Perfect. Thank you. Yeah, I actually recently attended a conference on ending cycles of violence and very targeted for tribal communities with education. And so I know we also have tribal health councils. I know Dr. Moore said she's interested in some materials. So thank you.
Yeah, absolutely. Please, please, please get with us for materials. If you guys don't have any, we would love to send you at least some. And then if you ever need like hundreds, we're so happy to send you hundreds too. So
Perfect. Any questions or feedback for Abigail on the services they provide? Hey, I think it's Friday. I think everybody's ready to get out the door.
I get it.
What is that website to access tools and resources?
So the web,
Oh, go ahead.
sorry.
Go ahead.
So the website to for NMSA in general for the helpline is nmsahelp.org. And that's on the first slide of the presentation. It's also on all of the cards. And then you're going to be sent two links after this meeting with how to request a presentation and how to request materials. And it states it in the links what you're requesting for that.
Perfect. I posted that in chat as well if you all like to access that. Um,
Thank you. I also I sent those over a little late yesterday, so that's why they have to be sent out after. That was my fault. I'm sorry. I was figuring out the whole QR code hyperlink thing. I'm working on it.
Cool. And then Dr. Morris says she can't access. Yeah, I posted it twice in the chat, Dr. Morris. It definitely pulled up on my end. Any other questions for Abigail while she's here?
Well, thank you guys so much for having me. Thank you for being patient with me. I know I spoke a little fast today, but hopefully you guys got everything you need. And if you need any clarification on anything, um, please feel free to email me at any time. And I always get back to my emails pretty quickly. So
Perfect. Thank you. Yeah. And I know it's always helpful to have, especially if you're going to communities. And I don't know how often, because I also know that sexual assault, the topic is very sensitive, and the type of data that you can share, at least an aggregated overview, I think is super helpful. If you plan to go to communities, or especially talking about the severity of the topic and why it's so important to bring awareness around your hotline, the helpline, apologies.
yeah.
Yeah, I think that's so incredible. I didn't know if you had some data or, things like health councils could look at on your website related to that.
Yeah, the data report is so dense with so much information that I'm positive that information is in there. It's just um, it takes a while to get to. So I like to focus on like the vulnerable populations with like the amount of people who are disclosing assault within the past year in New Mexico, just because that number is still so large. And then it's over half if we're thinking like a lifetime, like people who've been assaulted in their childhood or maybe earlier years.
Perfect. Yeah, thank you. Thank you so much. And taking the time to talk with health councils today. And if there are no other questions or comments, today's session is going to end a lot earlier. So that's totally fine. You all get time back in your day. But I hope you all take advantage of meeting with Abigail and NMSA helpline to connect this resource to your community. So if you have questions and you're having issues, just contact me and I can get you also coordinate a meeting with Abigail if you need that support.
Thank you all. I hope you guys have a great day.
Perfect. Thank you. And the recording will go out and the materials. So happy Friday and have a good weekend all. All right. Bye-bye.